How about we get started on this awesome topic today? You guys ready? Okay.
Yes.
Today's topic is all about your baby's oral health. Okay. And like we said, something that we haven't discussed much about, but really needs to have an entire episode dedicated to it. And that's because, what you do now, whether you're expecting or while your baby is itty bitty, okay, can impact their oral health for the rest of their lives. And that's one of those, just like we're talking about a window, a short window here to get in. It's similar to that, okay? You got a short window to really impact that and make a difference. And so we want to make sure that you have all the information and knowledge that you need, so you're not looking back and going, oh, I wish I would have known. Like, how many of you already do that all the time? I do. Like, I just didn't learn all this stuff when my kids were little. And so it's always about, when I hear about topics and think about topics that I wish I had known more about, that's the important stuff to bring to you now. Okay, so to do that, I'm also going to bring in our special guest today, okay, and that's Noelle Copeland, and she is from Brilliant Oral Care, and they're one of our new partners that does all kinds of oral care products for babies and children and pregnancy, okay, and others, okay, but for us and our related audience, it's really, we're gonna focus on some of that. So let me go ahead and bring Noelle in with us so that she can join this conversation. All right, there she is. Let me unmute her. Hi, Noelle.
Hi. Hey, how are you?
Good.
Good.
Good to see you.
Good to see you too.
I know, we're so happy to have you here. And I was like, what a great combination of being able to bring this topic to all these mamas out there and talk about such an important thing. And I remember when I first met you, Noelle, I was just so excited to introduce this to the entire audience and be like, this is something we haven't discussed and they really need to know.
Yeah, I agree.
Absolutely.
I'm really excited about that. Okay, great. So let's just start talking a little bit. I mean, the concept of your baby's oral health really starts way before they're even born, right? I mean, this is something you can be thinking and should be thinking about during a pregnancy.
Yeah, absolutely. And it all goes back to the diet for mom. Yep.
Tell me a little bit about what should moms really be thinking about when it comes to their diet? Like, what are the best ways for them to support their baby's oral development while they're pregnant? Like, when you say diet, what could they do?
Well, the primary teeth, they start to develop between about the 3rd and the 6th month of pregnancy. So anything that's going on in the mom at that time with her diet or environmentally can affect how the primary teeth develop. So, I mean, just a good healthy diet, high in calcium, high in phosphorus, vitamin D, all of those things are things that help have support healthy tooth development.
Awesome. And I know that, as a midwife, it was one of the questions that came up often for when they're pregnant is the fact that they have much more sensitive gums.
Oh yeah.
And there's a lot more bleeding. And could you explain why that's happening for moms and what they could start to think about using and doing? And let's talk a little bit about the product also and how that helps.
Yeah, so it's all hormones, glorious hormones.
It always comes back to hormones, doesn't it?
It really does. And so you're pregnant and your hormones completely change and your body is in this beautiful phase of making a human. And so you could not change anything about your oral care routine. And then all of a sudden you're pregnant and your gums are bleeding or they're more sensitive. And this is just your body's way of protecting the baby. So if you have bacteria in the mouth, your immune system's like, oh, bacteria, bad, inflammation. So you just become more susceptible to things like gingivitis and gum disease. So a lot of pregnant moms kind of get the misconception that, oh, is it safe to get my teeth cleaned or go to the dentist while I'm pregnant? There's x-ray machines there's other things. And it couldn't be any further from the truth. And in fact, you would want to probably even get your teeth cleaned more frequently, especially if you're having signs and symptoms of bleeding gums, sensitive teeth, sensitive gums. Getting your teeth cleaned more frequently can be beneficial.
Good to know.
Yeah. And And so one of the things too is the type of toothbrush you're using. So basically there's a soft, a sensitive soft, and they also make medium and hard toothbrushes. I don't know why they even still make those toothbrushes, because I don't want anybody to ever use a medium or hard toothbrush ever. And that's because you can brush away your teeth and gums. It's just too hard. A soft or something even softer. But if a mom is pregnant and is experiencing pregnancy gingivitis or some sensitive teeth and gums, and an extra soft toothbrush might be beneficial. And this allows her to clean effectively without irritating the gums more.
Gotcha.
And tell us a little bit about what makes your guys' brand different.
Okay.
Like, can you tell us a little bit about why you can kind of,
yes.
I also want to paint a picture, because I think seeing it too, it's really different. Your brushes are different. So let me go ahead and pull one in here, and if I can, I'm pulling it right here off of a Facebook. Let's see if this works. Can you guys see it?
Yes.
That's my mouth.
Is that your mouth?
Yeah, that's me.
Beautiful teeth.
Oh, thank you. Yeah, so this is our brilliant toothbrush. It's what made us Brilliant Oral Care. And so it is a patented round bristled toothbrush. It's 360 degrees of bristles all the way around the brush head. It's omnidirectional. So when you're brushing the teeth, you're also brushing the lip, the gum line. If you're inside the mouth, you're brushing the inside of the cheek. If you're on the back side of the tooth, you're also getting the sides of the tongue. So you're getting more surfaces at once. And it's a fantastic toothbrush. It's very soft DuPont Tinex bristles. All of the brushes are made developmentally. So one of the great things about our company as a whole is we have Brilliant Oral Care and the Baby Buddy brand, and we're a developmental oral care company. So we have products for you and your family from birth all the way to adult. So we cover everything that you need. Yeah. And we introduce the toothbrush to babies as soon as their first tooth comes in. So dental professionals will tell you, as soon as the tooth is in the mouth, you need to start brushing it. Yeah. With a bristled toothbrush.
Let's talk about that. So so now we understand that what we eat, getting enough of our minerals, and making sure that we are taking care of our own bodies while we're pregnant, and creating those resources that our body can pull from to build our baby, because that's basically what we're doing, right? It's super important to make sure that's all there. And also, while you're pregnant, taking care of your own oral health. But then, baby's born, right? And I think so many moms I think there's a big misconception that we don't really need to think about a baby's oral health till they have a tooth.
Right. And I get that. I have 3 kids and I'm a dental professional. So I totally get that. I mean, who wants to add another thing on their plate of stuff to think about? But it really is important. Yeah. And especially if there's any anomalies or issues going on, it becomes even more important. But just as a baseline, you want to start oral care as early as possible. Not when the first tooth comes in, when the first baby comes, that's when you want to start. And you're not only doing it in a manner in which you're cleaning the mouth, but you're also training the baby to have oral care done in the first place. And you're training yourself. It's probably the most beneficial for the caregiver, the mom, whoever is taking care of the baby, because most of the time when kids don't receive oral care, it's because the parent didn't do it. It's not because the kids didn't want to have it done or wouldn't have been receptive to it. So one of the most frustrating situations as a clinician and for parents is when they take their child to see the dentist for the first time and they don't do it in a timely manner. So they take the child at the age of 2, 3, 4. I've even seen 5-year-olds who've never been to the dentist before. And the parents have been very reserved on doing oral care, either because they tried and the child just, didn't want to have it done, or they just didn't know. And it just makes it so much more difficult for the child. And by the time of like age 5, stuff's going on. There's, they have a full set of teeth. They're eating a full solid diet And so it just needs to start early. And the training of the parent, I think, is the most important part. I have yet to see very few children that will adopt having an oral care program if it started early enough.
Yeah. And that's true for so many things. I mean, you know, when I see clients and I'm like, okay, your child has an articulation issue or has an oral motor issue or a tongue tie, it's really hard for us to get in there and do those exercises and put things inside the mouth to be able to help those things. Absolutely. If there hasn't been an oral care program, because baby's like, what are you doing? I don't understand like why you're putting something into my mouth. And even more so, those are some of the first questions that I ask parents. Like, when you do oral care, does your baby's tongue go to the side when you're cleaning their mouth? They're like, oh, am I supposed to be cleaning it right now? I'm like, oh dear, don't waste your time coming to me yet. You need to actually start that oral care regimen so that when you come to a medical professional, speech pathologist, dental hygienist, to be able to have the child used to having someone look inside their oral cavity. And it's really important for them to establish that that's okay, and then it's safe and there's nothing scary about it.
Yeah, and that's why platforms like this are just so great and so important, because you don't know what you don't know.
Right.
And if you're not in the know to go to the dentist or to do these things, why would you?
Right.
Unless you're seeking it out. But, I've got 3 kids. I can attest to the busyness of new babies and new schedules and new routines. So I totally get the struggle. The struggle's real.
So we've established that we should start that oral care early. I like saying within that first month, right? Because some babies are born with teeth, so it's important to do that. Yeah. When should they actually go in to be with the dentist? When should that first dental visit usually happen?
So assuming that the parent is getting regular dental care and going to the dentist, what I usually tell my patients is to combine them. So this would be as soon as the first tooth comes in. So the tooth, which is usually the bottom 2 front teeth, as soon as those pop in, you want to take your child to the dentist and have them be evaluated. Then the dentist nothing is going to happen other than the introduction of the child to this environment at the dental office. And a lot of times parents can do like a combination appointment where I'll say, let's schedule your appointment, come in, I'll do your cleaning.
Nice.
Push them in a stroller, let them watch, and I'll talk to them. And that has worked out real well. Sometimes it doesn't work out as well. And we don't, the parent can't quite get their teeth cleaned because they're having to, do baby stuff. But most of the time I would say it works out well. They just, bring the baby in a stroller, and then they don't even have to take the baby out of the stroller. The hygienist or the dentist will just glove up and take a look in the baby's mouth and just make sure that there's no anomalies, that everything seems to be developing normally. We'll look at the soft tissues, look at the ridge. You can tell when teeth are about to start coming in, because you can get these little bumps. We call it budding. The teeth start to bud up through the gums. It's like little seeds, and the gums will get red and irritated, and then they'll start to erupt.
So if the tooth comes in at 12 months, then that's the first visit. If the tooth comes in, which just happened to my girlfriend, at 3 months, that's when you first go in.
Yeah, I mean, and there's not really a specific answer for that. Like if you have, for instance, okay, I have 3 kids, and all 3 of my kids, their teeth came in completely different. I had one that had teeth coming in at 4 months, and they were slowly erupting a tooth every month and a half. And It was honestly torturous. It was just it was just like teething for forever. Okay. And then I had one of my kids that, they were over 12 months old. It was my firstborn. She's 12 now. So I don't remember exactly how old, but she was past her first birthday. And I thought, when is she going to get a tooth? And then all of a sudden they just started popping up. It was like a freight train. They just started coming in, just seemed like every week a new one was coming in. So the development pattern really varies very different from child to child. So don't let it discourage you if you have a 10-month-old or a 14-month-old and they still don't have their first teeth. Take it at stride, because they're coming.
Okay.
And
awesome.
Then unless, I just kind of say that feeling, if you feel like you want to take them to the dentist before the first tooth, if they're older, that's fine. If you want to wait till the first tooth comes in, that's kind of like the standard ADA recommendation, that once the first tooth comes in, you want to take them to the dentist.
Great.
Awesome. Yeah, can we talk a little bit about teething? I mean, I think this is a topic that people just want to know about, and I'm wondering if we could talk a little bit about that and how that relates to even what we're discussing today.
Mm-hmm. Yeah,
does it make it easier for them? Does it make it more difficult for them? Like, just, is there any connection?
Well, it's important. Teething is important, and babies need to be able to self-soothe. So they need to teeth. We don't want to prevent them from teething. Teething starts anywhere from 3 to 4 months, and that's when you'll start noticing the drool, you know, and you know this, their shirts will be soaking wet, and that's that increased salivation as the gums are preparing, the teeth are starting to shift up. So they need to be able to self-soothe. They need to have teethers. They need to have things to chew on. For one, this is what's helping them break the gums, and it's helping the process of teething. You can also help them by massaging the gums for them. So there's things that are like silicone toothbrushes, triple tray brushes that are soft, and that you can help massage their gums for them. And it's also cleaning at the same time. So especially if you use something like a finger toothbrush, you can get in there, do the brushing. Again, you're instilling that oral care early so that they're used to it, but you're also cleaning their mouth at the same time.
And Shari, do you have pictures of that, or should I show?
I do. I'm going to pull up pictures right now.
Okay, great.
I'm just trying to manage 50 windows here.
Yes.
and the binging that you hear is my alarms that are going off, and I can't figure out what that is. So things in your head, it's not you, it's me. So
no, that's great. Just because I want to be able to show everyone that.
Absolutely. I'm sorry. Here we go. Let's screen share, and let's go back a little bit to what we were talking about before, and wiping baby's mouth, and just kind of seeing some of the things that we were describing.
Yeah, so in this picture, you're seeing a baby that has teeth, obviously, having a tooth tissue used in their mouth, which is completely appropriate. But you can also use this exact same tooth tissue on a baby or an older toddler that doesn't have their teeth yet.
And tell them a little bit about your tooth tissues, because obviously, you know me, Noelle, I want to talk about a couple other things with that, but tell them a little bit about your tooth tissues and what makes them so unique.
Okay, so the tooth tissues are great. It's a bamboo-based wipe, a sterile wipe, and it's enhanced with xylitol, and it can be used on a newborn, which makes it fantastic. So one of the fantastic things that I learned from you, Dawn, was that you don't want to use something like a washcloth to wipe a baby's mouth. And people in my industry, they don't know that. And every time I talk to somebody, I'm like, don't do that, don't do that. But dentists are still regularly telling people to do that. So just use a washcloth and wipe. And the reason you don't want to do that, from what Dawn has educated me on, is that when they're teething, a lot of times they're also sucking. So if you have a non-sterile washcloth that hasn't been sterilized in a heat dryer for the time frame it should have been, there could be bacteria in that. Also, the fibers from the washcloth can be ingested and can cause immune issues if they get stuck in the throat. So you don't want to use a washcloth. But what you can use is like a tooth tissue. And our tooth tissues...
Back to that picture, you got an extra piece here, and we'll talk about that in a minute. But let me go back to the... if I can get there.
Yeah, you go back to that first one, and yeah, no, I don't like washcloths being used, and you know, when I worked in the hospital, I was constantly having to go down with a physician and scope out these babies, these poor babies, and pull out all this lint and strings and all this stuff that was causing infections for baby. And really having difficulties having that baby start solids because they were just constantly sick and causing so many issues. So I love your guys' tooth tissues and use them almost every day.
Yeah, I love them too. And they, you can use them yourself. I use them myself because they're enhanced with xylitol. And like I said, it can be used on a newborn. It's a safe, less than 1 gram amount of xylitol, but it lays the foundation for a healthy oral environment in the baby or in the adult or in the older child that you're using it on. And not only do you get the physical action of, you know, using the wipe in the mouth and physically wiping away any residue, but you also get the benefit of the xylitol. And the xylitol actually helps to inhibit the growth of the bacteria in the mouth by causing it to slide off the teeth and slide off the gums.
Awesome.
Nice.
You know, I wanted to let everybody know that we're going to be doing a giveaway today. Okay. You definitely want to get in on this. All right. So let me give everybody the code word for today. All right. Right now, you want to go ahead and type the word #MyBabyExperts, and Stephanie will post it there for you. And all you guys who've been around know what to do. Okay. #MyBabyExperts. If you're new here, it's your first time, just copy what everybody else is doing. Okay. Just follow along. Just follow along in the crowd there. Okay. So #MyBabyExperts. That will send you a message, and you'll be automatically entered to win a bundle from Brilliant Oral Care with all the little stuff that you need to be able to give your baby the best oral care, including yourself too. And we will make sure that you get what you need depending on the developmental stage of your child, or if you're pregnant. We'll get some information from you and you can tell us. I'd also like for you to now in the comments, tell us what you love about these products, why you're interested, what we said today, the one thing that you learned today so far that maybe you didn't already know that was most interesting for you, or most related to where you are in your life with your child and how that'll make a difference. So whatever you want to say about it, I'd love to hear your feedback. And that's how I can test you to know that you're all listening, you see?
Yeah.
Teacher in me saying, okay, now is everybody paying attention? So go ahead and post that and #MyBabyExperts, and we will continue here. Should I forward to that other picture? I want to understand a little bit more about what that was that we were looking at.
Yep.
This one.
Yeah.
Okay, so this is the wipe and brush. So this is actually the second stage in our developmental oral care program. So our oral care program starts at birth with the mouth wipes, tissue wipes, and that's the first step that you would use for baby. Then it goes to the finger toothbrush, which is the one that slides on your finger that has the little massager extensions, like a little mini toothbrush. And about around age 3-4 months, when a child typically starts to teeth, you have less time to get your little fingers in their mouth before they want to try to gnaw them off like little carrots. So the wipe and brush kind of solves that problem by allowing you to wipe and brush at the same time versus doing it in two separate oral care routines. So you wrap the wipe around your finger, you put the wipe and brush on, and then you're able to wipe with the mouth wipe and brush the tooth at the same time.
Oh, that's really interesting.
Yeah.
What a great idea. And I can imagine that, you know, you want to have that protection for your finger as well.
Yes.
Yep. That's awesome. I actually have that for my dog.
That's great. I do too.
He's 4 pounds.
I will say oral care is so important for your pets, people. If you're not brushing your pet's teeth, you need to start doing it, because they need it too. So that's another
life.
Yeah.
Absolutely. Can we discuss just a little bit about tooth decay in babies? I think there's a lot of like misconception when it comes to like breastfeeding and falling asleep at the breast and bottles, and then how that relates to what are we doing? So for example, your child, you know, breastfeeds during the night. Do we need to wipe their mouth after every time? Like a little bit more about their routine so that kids understand what's going on.
Yeah. So my brain, my mom's side of my brain is like, it's the middle of the night, I'm going to nurse my baby and go back to bed. And the dental part of my brain is like, no, wipe their mouth. So, you know, if you can do that, then yes, but I'm not going to say that it's an absolute must if you're nursing or bottle feeding your baby in the middle of the night to do oral care. Then if you're purposeful about doing it at other times, then you're doing a good enough job. So the thing that we know about pathogenic bacteria in the mouth is that there's a time frame to it. So it's about 24 to 48 hours that if that bacteria or the biofilm that forms on the teeth and gums, if it's allowed to stay undisturbed 24 to 48 hours, then it will start to proliferate and it can start to cause problems. So 24 hours is kind of the golden standard, as long as you're doing something every 24 hours. Twice a day is even better, especially, you know, as the older you get. We have to just do it twice a day.
And kids love getting into routines. Like that's what I find is like, you know, if you just like spring it on them.
Right. As I said,
I would assume take it slow. You know, like if this is your first time, you're just starting to introduce your child to it and they're already a few months old or even older, like we discussed earlier on, totally fine. First of all, no mom guilt at all.
No,
right? We're not shaming anyone. This is never about like doing it, you did it wrong. It's like what Noelle said, you know more, you do better. You know, you only know what you know.
Right.
Yep.
And knowing more, you'll do better, make better choices, whether that's yesterday or today, it doesn't matter. Today's a new day, so start. And if your child is already past that early age, it'll take, assume a little more time, but they do get into routines and they like it.
Yeah, and if they're older and you're just now starting, it's okay. If they're resistant, do what you can. If it's just the front of the first 2 teeth, then don't force it on them. The worst thing that you can do is try to shove your finger or a toothbrush in their mouth because it can hurt. Especially if you're using the wrong kind of toothbrush, if you're not using one that's made for a child's mouth, if you're not using one that's soft enough, and you try to force oral care on a child, you can hurt them. And if you hurt them, they're going to remember that and they're not going to want to do it anymore. So take it slowly and then talk to your dental professional, get their help. If you're struggling and you're starting late, just go, the dentists want to help you. The dental hygienist especially, that's our thing. They want to help you. We're service people, so they will give you every tip that they have, and every professional has their own little bag of tricks of stuff that works. So just go to your dentist if you're having issues. But kind of back to what you said about baby tooth decay. As soon as a tooth comes into the mouth, it can get decayed. And if it's exposed to too much of a sugary substance in the mouth, it can start to decay. So some of the things that you can do as a parent to prevent that, or of course, you know, if it's an older child, a healthy diet, you never want to let the baby fall asleep with like a bottle of juice.
Right.
For sure. Or any kind of liquid that contains sugar. Don't, and I've seen moms do this, and I think it was way more prevalent back in the day. I don't see as many moms do it now, but pacifier falls on the ground, they pick it up, suck it, stick it in the baby's mouth. That is the worst thing possible to do because your bacteria in your mouth is different and more mature than their bacteria, but you can transfer it to them. And you've seen this in the news recently where you've had infants and children be kissed by a relative that had some sort of infectious oral disease, and it's transferred to the baby, and they don't have the immune systems to to defend themselves to things like that, and it can be a serious situation. So don't promote saliva swapping activities. I know it's so hard not to kiss little babies on the mouth. I know it was from, and I'll admit, I kiss my babies right on the mouth because they're just so sweet and they smell so good and I love them so much, but you really should not do that, especially anybody else outside of you. Right. But, you know, back to starting oral care early. Start cleaning your baby's mouth early on. Get them used to it. Train yourself to do it. And then massaging their gums and just planning your first dental visit. Make sure you get them to the dentist.
I want to bring up another picture because we've talked a lot about like, you know, doing our babies, for us to perform oral care on our babies. But there's, you know, it does get to the point eventually and not too late where they start to, you want to start getting them into the routine of starting to do it themselves. And there's a picture that's here. I wanted to talk about some of the other products and, you know, what we're looking at here. Did we lose Noelle?
I think we might have.
Okay, so let me just stop sharing for a second. Why did we lose Noelle? I think, okay, great. So what we're gonna do is we're going to let's just stop her video right now.
And then restart. And I could talk about that product too. Go
ahead. Oh, hold on one second. Let me put her in the waiting room here.
Okay.
Okay, here we go. Okay, let me pull that back up, Dawn.
Yep.
Give me 1 second. There we go. And it was this one here.
So this is another stage in their developmental process through their developmental line. And this is to help baby be able to be a little bit more independent and actually have a handle to be able to hold on to that, to be able to start to do their own teeth brushing. And so it actually has 2 sides to it so that they can actually brush it and be independent. It's super soft, and it allows baby to actually start being a big baby and being a big boy or a big girl and be able to start to brush that. It's super flexible, and it has, again, 2 sides. So again, what I love about their line is that you're always kind of knocking things out. If you only have 10 seconds that baby's willing to do that, you're actually brushing the top and lower gums at the same time. And so it's just getting them into that habit and just kind of being able to do it much quicker than you usually could do with just a regular toothbrush. So I really love that aspects to this.
That's really cool. That's really cool. And then there's also, let me pull up the other pictures, which really go into so I saw that somebody was saying, I think it was Robin who said that her child loves her toothbrush because it's electric.
Yes.
You make electric toothbrushes.
They do.
I'm going to just pull that up here.
Yeah.
So all their toothbrushes are round. This is the electric one here, right? And then this was the, let's see, right there. Children's. Go ahead.
And that one is a longer handle one for a little bit older kids, and that's a manual toothbrush that you can do. And again, with that 360-degree end, so that actually you're brushing multiple teeth, gums, and tongue at the same time.
Yep. Okay, let me just see if I can get Noelle back. There she
Yeah.
is. Hey, okay. Sorry, I don't know what happened there.
I pushed a button.
I do that all the time. I push buttons and everything disappears. I hear you.
I'm sorry.
That's great.
No worries. I'm glad you're back.
Okay.
Awesome. Yeah, no, we were talking about some of the older child toothbrushes, and I just think it's such a important, I'm so glad we're going over this topic. Does anybody have any questions? I know they left some questions earlier.
Yeah, I highlighted a few if I could throw some of them in. So we've got a couple moms here that are like, hey, my baby's 4 months old or my baby's 7 months old. Is it too late to start?
No.
Where would they start? So in your developmental line, where would they start? If it's a 4-month-old, should we start at the tooth tissues and kind of gradually make that easier? Or what do you recommend when it comes to, they didn't know this information and now they have a 4-month-old or a 7-month-old? Where do they start?
Yeah, the tooth tissues is a fantastic place to start. And that's a 4-month-old. Like I said, adults, I use them. If I've had anything acidic like coffee or tea and I'm out and I'm in my car, I'll take one and just wipe it around because I want to get the xylitol in my mouth. So the tooth tissues are always appropriate and they can be used by anybody. And then the silicone toothbrushes would be the next step. So the finger toothbrush or the triple tray toothbrush, which is a toothbrush and a teether. And then as soon as the teeth come in, you want to use a bristle toothbrush and start brushing them.
Great.
Okay.
Great.
If you guys didn't enter the giveaway, again, I'm going to just say, because I see a bunch more people jumping in here, hashtag MyBabyExperts right now. Just type that into the comments. Okay. You'll get a message from me. And you guys were also asking, where can you get it? When you get to the message, it's going to take you through an entire message. You'll be able to look at it later. It has all the different products that we talked about, and you can click through, and there's even a discount code that you got to click through to get. Okay, but it's in there. All right, you'll get 10% off your order. It's going to take you right over to order directly. So go ahead and do hashtag MyBabyExperts, and if you're interested, you'll get all of that going on. Fantastic. Yeah, a whole bunch of people jump in. New people, there they go. Now hashtag MyBabyExperts.
There you go.
We got to keep repeating it because sometimes people jump in and out and then they're like, how do you win? That's how you win. Hashtag we will be not announcing the winner today here on the show, but right after. Okay, so we're picking winners. If you do hashtag MyBabyExperts, you will be entered. Okay, just make sure that you reply to the message there and post here telling us what you've learned today, why this is important to you, where you are in your developmental stage with your child or with your soon-to-be baby coming, okay? We just want to know where you're at and what's happening. And if you have questions, you can go ahead and post them here into the chat as well. How about I read a couple questions that came in earlier from our post this morning about it?
Great.
I'd like to, so Cheryl posted, my son is 14 months and still no teeth.
Mm-hmm.
I've taken him to the dentist and they said not to worry and that they can feel that the teeth are under his gum, feel like he's been teething forever, but just nothing happening for him.
Be prepared, Cheryl. They're coming. That was my experience with my firstborn. I was like, are they ever going to come? And then boy, they sure did. Just one right after the next, which I actually kind of prefer it that way, because then I just did the whole miserable kind of teeth coming in episode for about 4 months, and then we were done. So yeah, they're coming, Cheryl, but it's totally, you're fine.
Awesome. Courtney, let's see. Courtney said that she had preeclampsia at the end of pregnancy. She was delivered 4 weeks early. Baby had marks on their 2 front teeth. The dentist said it's because of not being well. Will the marks be there on her teeth, adult teeth?
Not necessarily. So you can think of, like I said, the primary teeth, which are the baby teeth. Sometimes people call them milk teeth. Those develop between the 3rd and the 6th month of pregnancy. And anything that happens in that time frame can affect the development of the teeth. And the teeth develop similar to like the rings on a tree. So they develop in layers. And if something happens, a super high fever or exposure to a virus, or I can't think of anything else off the top of my head, but just things that can affect the development of the tooth, you can have just a slight disruption in that formation, and it can cause things like lines on the teeth. So the fact that it's showing present in the primary tooth doesn't necessarily mean that it will also show up in the permanent tooth.
That brings up a question I'd love to talk about. Often you'll see that baby teeth will have more dental caries or cavities in them. You'll hear parents talking about that. Then is that an indication that the adult teeth will be in bad condition as well?
So this is the thing about baby teeth, and I've heard this so many times, is like, it's a baby tooth, it's going to fall out. Why does it matter if it has a cavity in there? And I can understand that thought process when you don't know, but the baby tooth is an important part of the structure of the development of the child's mouth. So the baby tooth holds the space for the permanent tooth that's still developing and forming underneath the gums. So if a baby tooth is lost prematurely because of decay or injury, sports injury, or not sports injury for a toddler, but like a fall.
Usually sippy cup injuries.
Yeah,
just saying.
Edge of table injury. But if it's prematurely lost, it can affect the permanent tooth. And so if you have something like decay, one of the things that's becoming more prevalent in the dental field is we're starting to call decay an active infection, because it holds more weight and value to a parent or to a patient, because that's exactly what it is. Decay is an infection of the tooth, and your teeth are like little people in your mouth. They have their own blood supply, they have their own nerve supply, and that blood supply travels throughout the entire body. So the blood that travels to the tooth in the mouth is also traveling to the permanent tooth in the mouth, and to the heart, and to the toes. So it's imperative that those teeth stay healthy. You don't want to just pull a baby tooth. You don't want to lose a baby tooth prematurely. You need to have them stay in as long as they're supposed to be there.
And I'm always telling parents too that it's giving us an indication from a feeding standpoint that we might need to switch some things up, right?
Oh, sure.
So when I see these kiddos that are having difficulties with their baby teeth and I start looking into their feeding, then the mom's like, oh yeah, we definitely are doing great with liquids. He's having 2 to 3, sippy cups of juice a day. And we're eating a lot of carbohydrates, but they're not eating a lot of fresh fruits and vegetables and different other things. And it makes it easier for me as a feeding therapist to be able to say, we really need to keep these baby teeth healthy, and we need to really look at some of this nutrition and see if we can expand that diet to not be so sugary and to actually have a little bit more in their food repertoire to be able to help those teeth. And so that when they get their permanent teeth, that we've already made these changes, because if not, we're going to just have more cavities there because we really worked on that diet.
And that goes back to, what you said, Shari, is that an indication that the permanent teeth are going to be this way? It can be, yes. If you're not, and we keep saying this, but you do have to, it's your job to train your child on how to eat, how to take care of themselves. And if you don't do that, they're not going to continue and carry to do that. And I myself and other clinicians can always tell when that hasn't happened, because you get an 18-year-old or a 21-year-old who still isn't flossing, who isn't brushing regularly. Then you send them off to college, and then they're, you know, in a dorm and they're eating college food, and their mouth just blows up, and they just get all of this, and, you know, gingivitis and early periodontal disease at 20 years old, which is something, you know, if you do ever experience it, it should be way later in life. So if a child has a high snack diet, like I said, I have 3 kids. I so get it. Like my kids just went back to school from summer break, and I was just like, if they ask me for a snack one more time, I just want them to eat a meal, but they're just like, I want a snack. I want a snack. But if you let a child just eat snacks all day, most snacks are sticky, gummy, and chewy things. Those are all things that are not good for your teeth. Most of them are high carbohydrate, high sugar, even things that people tend to think are more healthy: raisins, dried fruit, even gluten-free, like crackers that are rice-based or more starchy-based. Those are all sugars, and they stick in the pits and grooves of the teeth. And unless it's brushed out, which most of the time parents aren't giving their child a snack and then within 30 minutes brushing their teeth, it just sits there and waits for the saliva to wash it out. And all of that time, it's affecting the enamel of the tooth, and that is what leads to tooth decay. So I try my hardest to make my kids eat 3 meals a day, and if they do have a snack, I try to make it as healthy as possible, and it to be as far from a sticky, gummy, and chewy snack as it can be.
Yes.
If you're looking to figure out where you can find them, you can just type #mybabyexperts. You're going to get a link that will take you to shop for any of the products that we're talking about today. Because I have a whole bunch of people saying, where can I get it? Where can I find it? So yeah, you can do that. Are they available in stores too, Noelle? Can they go to like a Target or?
Yes. Yes. I don't have a list of all the stores we're available in, but off the top of my head, it's, you know, Walmart, Target, some pharmacies like Walgreens, even Kroger. But yeah, Bye Bye Baby.
Okay.
Yeah.
And I just want to touch for a minute too. I know we've discussed this, and for both of you, this is a big topic. You know, children with special needs and these products. Can you talk a little bit about that as well?
Yeah. So when Noelle and I first started talking, that was my biggest focus when I first found out about their brand, and actually Noelle started educating me on it, because of the fact that a lot of kids with special needs are orally defensive. So, you know, they don't like things being in their mouth. They don't like things touching their face. And so it's really difficult for parents to be able to do oral care, or even to be able to do consistent oral care, because their sensory system is constantly changing. So it's one day they tolerate oral care, the next day they don't, they bite, they kick, they scream. It just is constantly in flux. And so, and again, you know, a lot of these families didn't know that they had a child with special needs when they were a baby. And if they would have provided that oral care early and often, then we wouldn't have this issue now that we have, you know, something else that's going on, right? But I love your guys' products because it's silicone based. It makes it really soft, much more easier for, you know, my babies with Down syndrome or cerebral palsy or have seizure disorders. That makes it a little bit easier for parents to be able to utilize that with children with special needs. But the tooth tissues have been like the most successful thing with all the kids that I work with, just because it's easy and it's something they can independently do that doesn't have like a long handle or something that's scary that's going in and out. It makes it really simple. They've been used to baby wipes, and I always say it's like a baby wipe, but it's for your mouth. And it just makes it so simple for them to be able to be independent, be proactive, and feel like they can, you know, still do something. And it makes it easy for my families with children with special needs.
Yeah, I agree with everything that you said. Special needs oral care is a area that needs, you know, lots of attention, because there's people that just don't know. You mean, I have, my oldest was born with some special needs, and so we had no idea till she was born. And so you have this situation that's new, and so the last thing you're thinking about once you have a new baby is, how you're going to do their oral care. So if you're educating yourself beforehand while you're pregnant, at least you're giving yourself that knowledge of, this is something that I need to do, and I'm going to start it at an early stage. But yes, it is so important. Luckily, when she was a baby, I knew to use xylitol. I knew to wipe her mouth, so I did those things. But you know, we still had a lot of challenges with her teeth, and she has issues, you know, now because of things that she went through that she had no control over, and that I had no control when she was a baby. So I support that community of moms and families so much, because I understand it. And that's another reason why I love that our program is developmental, because you can use the mouth wipes on babies, and you can use the mouth wipes on a 15-year-old or an 18-year-old or a geriatric patient for the exact same reason. It cleanses physically, and you get that xylitol in the mouth that helps to decrease the levels of bacteria. And even like you mentioned, biting and oral. So I've found with my special needs patients in practice too, it seems like there's the two spectrums. They either are orally fixated, like they are orally stimulated and they just want to chew and they want something in their mouth, or they don't want anything in their mouth. And so it's this dichotomy of doing enough and just doing a little bit at a time. So if you have a biter, a chewer, a gnawer, you want to start out slow. You don't want to, you know, injure yourself using something like the tooth tissues. Try that, and then a silicone toothbrush, and use the silicone based toothbrush until you can get a little bit more control, if possible, of the biting. One thing that I've seen kind of across the board is parents that don't know to not let their kids bite, teeth, chew, gnaw on a bristle toothbrush. And it can damage the gum tissue on a child, a baby, or even an adult so bad. I mean, these brushes, as soft as the bristles are, you know, they're tiny little bristles. They're even rounded at the ends, but you can pierce the gums, especially on, you know, the standard one-sided flat toothbrushes is what I like to call them, as compared to our round ones. But the bristles are so long, and they usually don't round the edges. They're just sharp cut, and that can poke up into the gums, and they'll get ulcers. And then that you know, makes them even more reserved on having oral care done when they have sores in their mouth. So don't let them chew. If you're trying to do oral care, this comes up a lot. It's like, you know, I'm trying to brush my baby's teeth, and all they want to do is bite and chew. You know, just pull the toothbrush out, tell them no. And you might have to kind of go between a silicone based toothbrush, you know, a finger toothbrush, and then training on at the same time on a baby toothbrush. You might only be able to get in and do the front teeth to begin with, while you're doing the back teeth with a silicone based toothbrush, and they'll get it. I know we want it to just happen because we know how important it is, but they will get it. And once they do, they tend to really enjoy having their teeth brushed.
I'm so happy that you guys were able to be on with us, and I'm so happy, Noelle, that you were able to join us today and
thank you for having me.
All about such an important topic, and show us all the amazing products that I know you were very involved in developing over there. And you know, I just think it's wonderful, and I love, and of course, because Dawn and I do this on a regular basis, but I love when brands, companies really value the knowledge of experts. And know enough to know that they need to bring in real clinicians, real experts to help them develop out good products and create education. And I'm just so grateful to partner with your company and to have you guys join us as our partners as we go through the rest of this year and beyond, to provide this education. It's more than product. The products are the tools. We always say that, you know, the information that we're talking about today, that's the real gift. Okay. That is what you really need. And then you need these great tools to do it.
That is exactly correct.
No, so I'm really grateful that you guys are with us. This will be the first of many times that you guys will hear from us about these amazing products and this topic.